We all have different temperaments, okay? There's 5 dimensions of temperament. Extroversion, that's sensitivity and threshold for positive emotion. Neuroticism, that's sensitivity and threshold for negative emotion. Agreeableness, that's kind of maternal compassion and empathy versus a kind of tough, more individualized, what would you call it?
Decisiveness.
Yeah, good. Conscientiousness, that's dutifulness, industriousness and orderliness. Openness, that's creativity and interest in ideas. 5 dimensions. Okay. Where you land on those dimensions is determined to a large degree by the genetic lottery. And now there's some movement on each dimension that can occur as a consequence of socialization, but it's bounded by the place you landed when the cards were dealt, by the genetic code when you were born. And you might say, well, that's unfair. It's like, well, it's not unfair exactly. It's just, there's a randomness about it within a bounded world. And it's not unfair partly because every advantage comes with a disadvantage. So if you're extroverted, you're social and you're positive, but you're impulsive. And you can tilt towards hedonism, and you can't stand being alone. If you're high neuroticism, well, you suffer a lot of anxiety and pain, but you're pretty sensitive to threat, and you might see danger before anyone else does, and then you don't die. And so, and maybe your children don't either. And if you're agreeable, well, you're compassionate and caring, but you're going to not stand up for yourself very well, and you're going to your temptation is going to be bitterness and resentment. If you're conscientious, well, you're orderly and industrious, but you can get obsessive. And if you're creative, well, then you end up with purple hair and nose rings. And I did a study at Harvard in like 1994 when piercing and tattooing started to first emerge on the cultural landscape, because we were trying to find out if it was a marker for psychopathology, which wasn't obvious at that point. Well, because it was a subcultural practice before that. It was circus people and prisoners and so forth that were tattooed and who were pierced. And then it spilled into the mainstream, and we were curious, as I was in the psychopathology and personality sub-department in the Harvard Department of Psychology, and I worked with a colleague of mine, Jill Hooley, and we never published this study. Many studies end up not published, but it was very interesting. The best predictor of tattooing and piercing was just creativity. There's no sign of assorted psychopathology, except the psychopathology associated with creativity. And you might say, well, what's that? And it's like, well, most creative ideas are stupid and wrong. So, why shouldn't you have ideas? Well, because most of your ideas aren't any good. And how do you know that? Well, try starting a business. The probability that you're going to fail is extremely high. Most people who end up with a successful business have failed multiple times because it's very hard to figure out what the market needs this moment. It's really hard, and so you'll flail around trying to hit that target. And if you're creative, you're going to come up with a lot of ideas, but that doesn't mean they're good. And even if they are good, doesn't mean they'll work. And so most people, because most people aren't creative, by the way, they're not even a little bit creative, and that's because creativity is a high-risk, high-return strategy, and if you win, you can win big, but the probability that you lose is pretty damn high. Hardly anybody makes any money from a book, and it's really hard to write a book. And like, how many books have you written? None. And how many successful books have you written? And, like there's a 1 in 100 chance maybe that you've written a book. I doubt if it's that high. Like actually written and published a book. It's probably more like 1 in 1,000. And then 99.9% of books sell less than 200 copies. So you got a 1 in a million chance at best of writing a book that is going to be successful. And you might ask, well, then why bother? And the answer is, well, most people don't. That's how they solve that problem. Just don't do that, and then you won't fail. And most of you probably haven't written a symphony, or even a song, or a play, and you probably don't dance, but some of you do, but I doubt if you've ever generated a truly original dance, except by accident, and then generally people will just laugh about that. So we studied creative achievement across a wide range of people we had developed a 13 domain scale with 8 levels of competence in each domain. So on the musical front, it would be, I have no training or interest in this area. I've written original compositions that have been played internationally by major musicians. And you sum across all 13 domains, and the median score, which is the most typical score, is 0, and 70% of people score 0. And the next most common score is 1. And that's like, now you got 80% of people. Okay, what's my point? No matter where you land in the temperamental landscape, you're going to have your associated faults and temptations. And you're going to have your associated proclivity to your particular form of mental illness. So now, that might visit you if you're particularly unlucky, or you might fall into that if you're incautious. But you generally don't get an advantage without an attendant disadvantage. So that's on the genetic front. And then there's environmental variability, for sure. You can take a neurotic child. The studies have already been done on this. So some children by, let's say 2, although you can actually measure this by 6 months. So imagine you have a child in a room, lab, and his or her mother is there. And the mother's sitting and the child's here. And then a little wheeled robot is remote controlled in by the experimenter. Well, some kids will just run right over and engage with the robot, and other kids will hide behind their mother and then sort of peek out. And the ones who hide are higher in negative emotion. And then if it's a baby-eating robot, they're not dead. So that's their strategy. Whereas the, hey, your kids are going to go play with a strange dog at the playground, or not. And sometimes that's real fun. And sometimes it's no fun at all. And sometimes it's the, kid who's hiding behind his mother's legs that doesn't have his face torn off by the pit bull. So there's variability for a reason, and then the more neurosis prone, the more kids more prone to negative emotion, they're going to suffer from a higher proclivity for depression and anxiety later in their life, and that's the price they pay for their threat sensitivity. But if you take those kids and you really encourage them to explore voluntarily instead of facilitating their proclivity to hide themselves, you can tilt them up into the normal range for negative emotion. And those studies have already been done. And so you're never going to take a kid who's really high in trait neuroticism and make them as low in trait neuroticism as someone, at the 99.9th percentile genetically. You just can't. And maybe you could do it if you did nothing else than train that child like 12 hours a day for 10 years. But you can shift people a fair bit. And if you're introverted, you can learn extroverted skills. And if you're agreeable, you can learn to stand up for yourself. And if you're unconscientious, you can learn to discipline yourself, although that's a tricky one. Because you usually don't have the discipline to discipline yourself if you're unconscientious. So